Here's a 10 to 15 minute video script in English on the topic of bacterial diseases, written for narration-only educational YouTube content. It's informative, structured, and paced to fit the time range when read slowly and clearly. Title: Understanding Bacterial Diseases, Causes, Symptoms, Prevention and Treatment. Intro 30 seconds. Narrator: Welcome to our channel, where we simplify health topics for everyone. In today's video, we'll explore a very important subject: bacterial diseases. What causes them? How do they spread? What symptoms should we look for? And how can we protect ourselves and our loved ones? Let's begin. Section 1. What are bacteria? 1.5 minutes. Narrator: Bacteria are microscopic organisms found almost everywhere, in the air, water, soil, and even inside our bodies. Not all bacteria are harmful. In fact, many are essential for life. We have good bacteria in our gut that help with digestion, immunity, and even producing vitamins. But some bacteria can cause illness. These harmful ones are called pathogenic bacteria. When they enter the body and multiply, they can interfere with normal functions and release toxins, leading to infection and disease. Section 2. Common bacterial diseases. 2 minutes. Narrator: Let's look at some common bacterial diseases and how they affect us. Tuberculosis, a serious infection that usually affects the lungs. It spreads through the air when an infected person coughs or sneezes. Pneumonia, caused by bacteria like Streptococcus pneumoniae, leading to inflammation in the lungs. Strep throat, a painful throat infection common in children and teens. Cholera, a waterborne disease causing severe diarrhea, mainly in places with poor sanitation. Urinary tract infections, UTIs, common in women, caused by bacteria entering the urinary system. Food poisoning, caused by bacteria like E. coli or Salmonella when we eat contaminated food. Each of these diseases has its own symptoms, risks, and treatment, but all are caused by bacteria. Section 3. Symptoms of bacterial infections. 1.5 minutes. Narrator: So, how do you know if you have a bacterial infection? Here are some general symptoms: high fever, fatigue and weakness, cough or sore throat, skin redness, swelling, or pus, pain during urination, diarrhea or vomiting. Remember, these symptoms can also occur in viral infections. That's why proper diagnosis is important before starting any treatment. Section 4. How bacterial diseases spread. 1.5 minutes. Narrator: Bacteria can spread in many ways. Through the air, like tuberculosis or whooping cough. Through water, like cholera or typhoid. Through contaminated food, like E. coli or Salmonella. Through direct contact, like skin infections. Through insect bites, like Lyme disease from ticks. Poor hygiene, crowded places, and lack of sanitation can increase the risk of spread. Section 5. Treatment. 2 minutes. Narrator: Most bacterial infections can be treated with antibiotics. These are medicines that kill bacteria or stop them from growing. But here's the catch: antibiotics don't work on viruses. Taking antibiotics when you don't need them can lead to antibiotic resistance, a serious global health problem. That means the bacteria become stronger and no longer respond to medicines. Infections become harder to treat, and recovery takes longer. Always take antibiotics only when prescribed by a doctor, and complete the full course even if you feel better. Section 6. Prevention. 2 minutes. Narrator: The good news is that many bacterial diseases can be prevented. Here's how. Wash your hands regularly with soap and water. Avoid sharing personal items. Drink clean, safe water. Store and cook food properly. Keep your environment clean. Use antibiotics responsibly. Get vaccinated. Vaccines like the tetanus, tuberculosis, BCG, and pneumonia vaccines protect against some bacterial diseases. A healthy lifestyle and good hygiene habits go a long way in preventing infections. Conclusion. 1 minute. Narrator: To sum up, bacteria are all around us, but not all are harmful. When harmful bacteria cause infections, symptoms can range from mild to life-threatening. With proper awareness, hygiene, medical care, and responsible antibiotic use, we can fight back against bacterial diseases. Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe for more health education videos. And as always, stay informed, stay healthy.